The fluorescent lights of St. Margaret's Hospital hummed their familiar tune as Nurse Keisha Williams adjusted her stethoscope and checked her watch. It was barely past 7 in the morning, but she'd already been on her feet for 2 hours, having arrived early to review patient charts before her 12-hour shift officially began. At 28, Keisha had been working at St. Margaret's for 6 years, ever since graduating from nursing school with honors from Howard University. St. Margaret's was one of Boston's most prestigious medical centers, a sprawling complex of brick and glass that served the city's elite, as well as its most vulnerable populations. The hospital prided itself on cutting-edge medical technology and world-class physicians, but like many institutions, it struggled with issues that went deeper than medical expertise. Keisha had chosen nursing because she wanted to make a difference in people's lives during their most vulnerable moments. Growing up in Roxbury, she'd seen firsthand how healthcare disparities affected her community, and she was determined to be part of the solution. She'd worked double shifts to pay for school, studied while her classmates partied, and graduated at the top of her class with dreams of eventually becoming a nurse practitioner. That morning, she was assigned to the cardiology wing, where she'd been working for the past 3 years. Her patients loved her, often requesting her specifically when they returned for follow-up visits. She had a gift for making even the most anxious patients feel comfortable, explaining procedures in simple terms, and always taking time to listen to their concerns. Room 314 housed a new patient, admitted late the previous evening with chest pains. The chart indicated he was a 72-year-old man named Robert Chen, listed as retired with no emergency contacts on file. When Keisha entered the room, she found a dignified elderly Asian man sitting up in bed, dressed in a simple hospital gown, but carrying himself with unmistakable authority. "Good morning, Mr. Chen," Keisha said with her characteristic warm smile. "I'm Nurse Williams and I'll be taking care of you today. How are you feeling this morning?" Mr. Chen looked up from the newspaper he'd been reading and smiled back. "Much better, thank you. The chest pains have subsided, and I got a good night's sleep." "You have excellent nurses here." "I'm glad to hear that," Keisha replied as she began her morning assessment, checking his vitals and examining the monitors connected to his chest. "The doctor should be making rounds soon, but everything looks stable. Are you experiencing any discomfort now?" "Just a little soreness from where they inserted the IV, but nothing serious." "You have very gentle hands, Nurse Williams. I've been in many hospitals over the years, and I can always tell when someone truly cares about their work." As Keisha finished her assessment, she noticed Mr. Chen watching her with keen interest. There was something in his eyes that suggested he was accustomed to observing people carefully, perhaps evaluating them in ways that went beyond casual conversation. The morning proceeded normally until Dr. Harrison Mitchell arrived for his rounds. Dr. Mitchell was a cardiologist in his early 40s with perfectly styled blonde hair and an expensive suit visible beneath his white coat. He'd joined St. Margaret's 2 years earlier after completing his residency at Johns Hopkins, and he'd quickly gained a reputation for his medical expertise as well as his arrogant demeanor. Dr. Mitchell had grown up in an affluent suburb of Boston, the son of a prominent attorney and a socialite mother. He'd attended private schools his entire life, sailing through Harvard Medical School on family connections and natural intelligence. He was undeniably skilled at his job, but he carried himself with the kind of entitlement that came from never having to prove himself beyond his academic credentials. When Dr. Mitchell entered room 314, he barely glanced at Keisha as she prepared to give him the morning report on Mr. Chen's condition. Instead, he walked directly to the computer terminal and began pulling up the patient's charts, his back turned to both the nurse and the patient. "Mr. Chen, I'm Dr. Mitchell, your cardiologist," he said without looking up from the screen. "I've reviewed your test results from last night and I want to run a few more diagnostics this morning." Keisha stepped forward to provide the patient update. "Doctor, Mr. Chen had a stable night. His vitals are all within normal ranges, and he reports no chest pain since admission. I've been monitoring his heart rhythm, and there haven't been any irregularities." Dr. Mitchell finally turned around, and his expression immediately shifted when he saw Keisha. There was something in his eyes, a flash of annoyance or dismissal that she'd seen too many times before. It was the look that said she didn't belong in his world of prestigious medicine. "I can read the charts myself, nurse." "Doctor," Mitchell said curtly, "I don't need a recap from you. Just make sure his medications are administered on time and try not to disturb him unnecessarily." The tone was professional enough that it might have seemed normal to a casual observer, but both Keisha and Mr. Chen caught the underlying condescension. Keisha maintained her composure, though her jaw tightened slightly. Of course, doctor. Is there anything specific you'd like me to monitor throughout the day? Doctor. Mitchell waved her off dismissively. Just do your job, nurse. I'll handle the medical decisions here. As Dr. Mitchell began examining Mr. Chen, asking questions about his symptoms and medical history, Keisha remained in the room to assist as needed. It was standard protocol for nurses to be present during physician examinations, but Dr. Mitchell seemed increasingly irritated by her presence. The situation escalated when Mr. Chen asked about his medication schedule. Doctor. Mitchell began explaining the treatment plan, but he used complex medical terminology without bothering to translate it into layman's terms. When Mr. Chen looked confused, Keisha stepped in to help. What Dr. Mitchell is saying, Mr. Chen, is that we're going to give you medication to help your heart work more efficiently, and we'll monitor your response over the next day or two. Dr. Mitchell whirled around, his face flushed with anger. Excuse me, Nurse Williams, but I don't recall asking for your input. I'm perfectly capable of communicating with my patients without assistance from someone who clearly doesn't understand the complexity of cardiac medicine. The words hung in the air like a slap. Mr. Chen's eyebrows rose slightly, and he leaned forward in his bed, suddenly very alert to the dynamics playing out before him. Doctor, I was just trying to help clarify, Keisha began, but Dr. Mitchell cut her off. Help clarify? Doctor. Mitchell's voice rose slightly, and his tone became openly hostile. Let me make something crystal clear, Nurse Williams. You're here to take vital signs and distribute medications, not to practice medicine. I didn't spend 8 years in medical school to have someone with a 2-year nursing degree second-guess my patient communications. The insult was particularly stinging because Keisha had actually earned a 4-year Bachelor of Science in Nursing, not the 2-year associate degree that Dr. Mitchell dismissively referenced. But beyond the factual error, his words carried implications that went far deeper than professional hierarchy. I understand, Doctor, Keisha replied quietly, her professionalism intact despite the humiliation she felt burning in her chest. Dr. Mitchell wasn't finished. And another thing, he continued, turning slightly so that both Keisha and Mr. Chen could hear him clearly. I don't know what kind of standards they have at whatever school you attended, but at this hospital we maintain professional boundaries. Nurses don't interrupt physicians during patient consultations, and they certainly don't presume to explain medical treatments they clearly don't comprehend. Mr. Chen watched this exchange with growing concern and anger. As someone who had spent decades observing workplace dynamics and professional interactions, he recognized what he was witnessing. This wasn't simply about medical hierarchy or professional boundaries. The condescension in Dr. Mitchell's voice, the way he emphasized certain words, and his assumptions about Keisha's education and capabilities all pointed to something much more troubling. Dr. Mitchell, Mr. Chen interjected gently. Nurse Williams was simply trying to help me understand. I appreciated her explanation. Dr. Mitchell turned to his patient with a forced smile that didn't reach his eyes. Mr. Chen, I appreciate your courtesy, but please understand that medical care is most effective when there's a clear chain of command. Nurses like Williams here mean well, but they sometimes forget their place in the medical hierarchy. The phrase forget their place landed like a physical blow. Keisha felt her hands clench involuntarily, but she maintained her composure through years of practice dealing with difficult colleagues and subtle discrimination. Now, Doctor, Mitchell continued, returning his attention to Mr. Chen, let me explain your treatment plan properly. We're going to start you on a beta blocker to regulate your heart rate, and I want to schedule an echocardiogram to get a better picture of your cardiac function. As Dr. Mitchell continued his explanation, using the same medical terminology that had confused Mr. Chen moments earlier, the elderly patient found himself paying more attention to the nurse than to the doctor. He watched as Keisha quietly went about her duties, checking equipment and updating charts, her dignity intact despite the public humiliation she'd just endured. There was something about her composure that impressed Mr. Chen deeply. He'd witnessed many people face adversity throughout his long career, and he recognized strength when he saw it. Keisha Williams was clearly a professional who took pride in her work and genuinely cared about her patients, yet she'd been treated with disrespect that seemed to go beyond simple professional disagreement. After Dr. Mitchell finished his examination and left the room, an uncomfortable silence settled over the space. Keisha continued her work quietly, but Mr. Chen could sense the emotional impact of what had just occurred. Nurse Williams, Mr. Chen said softly, I want to apologize for what just happened. That was entirely inappropriate. Keisha looked up, surprised by his words. Thank you, Mr. Chen, but you don't need to apologize. I'm used to working with different personalities. That wasn't about personality, Mr. Chen replied firmly. What I witnessed was disrespectful and unprofessional. You were trying to help me understand my treatment, and you did so with clarity and compassion. Your intervention was appropriate and appreciated. For the first time that morning, Keisha's professional mask slipped slightly, and Mr. Chen saw a flash of the hurt she'd been hiding. Thank you for saying that. It means more than you know. Over the following hours, Mr. Chen observed the dynamics of the cardiology ward with growing interest and concern. He watched as Keisha interacted with other patients, noting her expertise, compassion, and professionalism. He saw how other staff members respected her knowledge and sought her advice on difficult cases. It became increasingly clear that she was not only competent, but exceptional at her job. When Dr. Mitchell returned for evening rounds, the scene repeated itself with disturbing consistency. Again, he dismissed Keisha's input, spoke over her when she tried to provide patient updates, and generally treated her as if she were invisible or incompetent. The behavior was subtle enough that it might not have been noticed by a casual observer, but Mr. Chen was far from casual in his observations. During one particularly uncomfortable exchange, Dr. Mitchell questioned whether Keisha had properly administered a medication, implying that she might have made an error without any evidence to support his suspicion. When Keisha calmly showed him the documentation proving she'd followed his orders exactly, he simply grunted and moved on without acknowledgement or apology. That evening, after Dr. Mitchell had left and the ward had settled into its nighttime routine, Mr. Chen asked Keisha to sit down for a moment. She hesitated, clearly conscious of the professional boundaries that Dr. Mitchell had so pointedly emphasized earlier. Please, Mr. Chen said gently. I'd like to talk with you if you have a few minutes. Keisha sat down in the chair beside his bed, maintaining appropriate professional distance but willing to listen to her patient's concerns. How long have you been a nurse, Ms. Williams? 6 years here at St. Margaret's, and I graduated from nursing school 7 years ago. And where did you go to school? Howard University in Washington, D.C. I have a Bachelor of Science in Nursing, not the associate degree that Dr. Mitchell mentioned. Mr. Chen nodded thoughtfully. Howard is an excellent institution. You must have worked very hard to get there and to succeed in such a demanding program. I did, Keisha replied simply. My mother cleaned offices at night to help pay for my education, and I worked 2 jobs while I was in school. But it was worth it. I love what I do. It shows, Mr. Chen said. In my experience, the best healthcare providers are those who combine clinical expertise with genuine compassion. You clearly have both. As they talked, Keisha found herself opening up to Mr. Chen in a way that surprised her. There was something about his manner, a combination of wisdom and genuine interest, that made conversation feel natural and safe. Can I ask you something, Mr. Chen? What did you do before you retired? Mr. Chen smiled mysteriously. I worked in administration, healthcare administration actually. I spent many years observing how hospitals function, how staff interact, and how patient care is delivered. That must have given you interesting insights into places like this. Indeed it did, and what I've observed here over the past day has been quite enlightening. The next morning brought a new dynamic to room 314. Dr. Mitchell arrived for rounds as usual, but this time he was accompanied by Dr. Patricia Rodriguez, the chief of cardiology. Dr. Rodriguez was a respected physician in her 50s who had built her reputation on both clinical excellence and strong leadership skills. Good morning, Mr. Chen, Dr. Rodriguez said warmly. I'm Dr. Rodriguez, and I wanted to check on you personally and review your treatment plan. Dr. Mitchell looked surprised and slightly uncomfortable. Chief Rodriguez, I didn't realize you were planning to see Mr. Chen. His case is fairly straightforward. I like to check on our patients periodically, Dr. Rodriguez replied smoothly. It helps me stay connected to the day-to-day operations of the department. As Dr. Rodriguez examined Mr. Chen and reviewed his charts, she frequently turned to Keisha for input, asking about the patient's night, his response to medications, and any concerns she might have observed. Her manner was collegial and respectful, treating Keisha as a valued member of the healthcare team. Dr. Mitchell watched this interaction with growing discomfort, clearly unused to seeing nurses treated as professional equals by senior physicians. Nurse Williams, Dr. Rodriguez said after completing her examination, your documentation has been excellent, and it's clear that Mr. Chen has received outstanding care. Thank you for your attention to detail. After Dr. Rodriguez left, Dr. Mitchell seemed determined to reassert his authority. He began questioning Keisha's nursing notes, suggesting that she was being overly thorough in her documentation and wasting time on unnecessary details. Dr. Mitchell, Mr. Chen interrupted quietly. I've been in many hospitals and I can tell you that Nurse Williams provides exceptional care. Her attention to detail and patient advocacy are exactly what I would hope to see in a world-class medical center. Dr. Mitchell forced a smile. Of course, Mr. Chen. I'm sure you appreciate the nursing care. I just want to make sure we're operating efficiently. Efficiency should never come at the expense of quality patient care, Mr. Chen replied mildly, but his words carried weight that made Dr. Mitchell pause. That afternoon, Mr. Chen asked to speak with the hospital's patient advocacy department. When the patient advocate arrived, he requested a private meeting to discuss his experience during his stay. The advocate, Maria Santos, was an experienced professional who had handled numerous patient complaints over her 10 years at St. Margaret's. Mr. Chen, what can I help you with today? Ms. Santos, I want to discuss some concerns about the professional dynamics I've observed during my stay, particularly regarding the treatment of nursing staff by one of the physicians. Mr. Chen proceeded to describe in careful detail his observations of Dr. Mitchell's behavior toward Keisha Williams. He spoke about the dismissive tone, the public humiliation, the questioning of her competence without cause, and the overall atmosphere of disrespect that seemed to characterize their interactions. These are serious allegations, Mr. Chen. Are you willing to file a formal complaint? I am, but I want you to understand that this isn't about personal animosity or a single incident. What I've witnessed suggests a pattern of behavior that undermines the collaborative care model that makes hospitals function effectively. More concerning, it appears to reflect biases that have no place in a professional medical environment. Maria Santos took detailed notes, knowing that complaints involving physician behavior toward nursing staff required careful investigation. St. Margaret's had been working to improve workplace culture and professional relationships, but change was often slow in traditional medical hierarchies. That evening, Keisha was surprised to be called to a meeting with her nurse manager, Patricia Hayes. Patricia was a veteran nurse with 25 years of experience who had worked her way up through the ranks to become one of the most respected nursing leaders at St. Margaret's. Keisha, I've received some feedback about your work on the cardiology unit, and I wanted to talk with you about it. Keisha's heart sank, assuming that Dr. Mitchell had filed some kind of complaint about her performance. The feedback, Patricia continued, was from a patient who wanted to commend your professionalism and expertise. He was particularly impressed with your patient advocacy and clinical knowledge. Relief flooded through Keisha as Patricia continued to share the positive feedback, but she was puzzled about why a routine compliment required a formal meeting. There's something else, Patricia said more seriously. The same patient has filed a formal complaint about Dr. Mitchell's treatment of you. He's alleging unprofessional behavior and what he describes as disrespectful conduct toward nursing staff. Keisha felt a mix of gratitude and concern. While she appreciated Mr. Chen's support, she worried about potential retaliation from Dr. Mitchell. Patricia, I don't want to cause any problems. I can handle working with difficult physicians. Keisha, Patricia replied firmly, you shouldn't have to handle disrespectful treatment. Professional collaboration is essential to patient care, and no physician has the right to humiliate or belittle nursing staff. The patient's complaint is being taken seriously by administration. The next morning brought an unexpected development. When Keisha arrived for her shift, she found that Dr. Mitchell was not making rounds on his usual patients. Instead, Dr. Rodriguez was personally overseeing the cardiology unit, and she made a point of speaking with each of the nurses individually. When Dr. Rodriguez reached Keisha, she asked to speak privately in the unit's family conference room. Nurse Williams, I want you to know that the hospital takes workplace professionalism very seriously. We've received a patient complaint about Dr. Mitchell's behavior, and we're conducting a thorough investigation. Dr. Rodriguez, I don't want special treatment. I just want to be able to do my job effectively. I understand, and I respect that attitude. But I also want you to know that your work here is valued and that you have the full support of the nursing and medical administration. Patient advocacy like yours is exactly what we hope to see from our staff. Meanwhile, Mr. Chen was preparing for his discharge. His cardiac tests had all come back normal, indicating that his chest pains had been caused by stress rather than any serious heart condition. As he prepared to leave, he asked to speak with Keisha one final time. Nurse Williams, I wanted to thank you for the excellent care you've provided during my stay. You've made a difficult time much more comfortable, and I want you to know that your professionalism has not gone unnoticed. Thank you, Mr. Chen. I hope you continue to feel well, and please don't hesitate to contact us if you have any concerns. Mr. Chen smiled mysteriously. I have a feeling that the concerns I witnessed during my stay here will be addressed appropriately. After Mr. Chen's discharge, the investigation into Dr. Mitchell's behavior moved quickly. Hospital administration interviewed several nurses who worked on the cardiology unit, and a pattern of disrespectful behavior emerged. While none of the incidents individually rose to the level of formal disciplinary action, together they painted a picture of a physician who consistently undermined collaborative patient care. Dr. Mitchell was called to a meeting with Dr. Rodriguez and the hospital's chief medical officer, Dr. James Park. The meeting was professional but serious, focusing on expectations for physician behavior and the importance of respectful collaboration with all members of the healthcare team. Dr. Mitchell, Dr. Park began. We've received concerning feedback about your interactions with nursing staff. Can you help us understand your perspective on these issues? Dr. Mitchell attempted to defend his behavior as necessary for maintaining medical standards and professional hierarchy, but his explanations only reinforced the concerns that had been raised. Harrison, Dr. Rodriguez interjected. Effective medicine requires collaboration and mutual respect among all team members. Nurses are highly trained professionals who play a crucial role in patient care. Dismissing their input or treating them disrespectfully undermines the entire care team. The meeting concluded with Dr. Mitchell being placed on a formal professional development plan, requiring him to complete training on workplace communication and collaborative care. He was also assigned a senior physician mentor who would observe his interactions with staff and provide ongoing feedback. 2 weeks later, Keisha was surprised to receive a call from Dr. Rodriguez asking her to come to the administrative offices. When she arrived, she found Dr. Rodriguez waiting with a man she didn't recognize, a distinguished-looking gentleman in his 60s wearing an expensive suit. Nurse Williams, Dr. Rodriguez said, I'd like you to meet Dr. Robert Chen, the chairman of the board of directors for St. Margaret's Hospital. Keisha's eyes widened as she recognized the patient from room 314, though he looked very different in his business attire than he had in his hospital gown. Dr. Chen smiled warmly. Hello again, Nurse Williams. I thought it was time to reveal my full identity and to thank you properly for the exceptional care you provided during my recent stay. As the truth settled in, Keisha realized that her patient had been one of the most powerful people in the hospital the entire time. Dr. Chen had founded one of Boston's most successful medical device companies before retiring to focus on healthcare philanthropy and hospital governance. Dr. Chen continued, I want you to know that your professionalism and patient advocacy exemplify everything we hope to achieve at St. Margaret's. The way you handled a difficult situation with grace and dignity while continuing to provide excellent patient care was truly impressive. Dr. Rodriguez added, We're announcing the creation of a new Patient Advocacy Excellence Award, and you'll be the first recipient. This annual award will recognize nursing staff who demonstrate exceptional commitment to patient care and professional collaboration. Dr. Chen had one more surprise. In recognition of your outstanding service and to support your professional development, the hospital board has approved a full scholarship for you to pursue your Master of Science in Nursing degree. We'd like to support your goal of becoming a nurse practitioner. Keisha felt tears welling up in her eyes as she processed what she was hearing. The scholarship would allow her to achieve her dream of advanced practice nursing without the financial burden that had seemed insurmountable. Thank you both, Keisha said quietly. This means more than I can express, but I want you to know that I didn't do anything special. I was just doing my job the way I was trained to do it. Dr. Chen shook his head. What you did was special, Nurse Williams. You maintained your professionalism and your commitment to patient care even when facing disrespectful treatment. That kind of character and dedication is exactly what we need more of in healthcare. Over the following months, the culture on the cardiology unit began to change noticeably. Dr. Mitchell, while still present, had modified his behavior significantly after his formal counseling and ongoing mentorship. He began acknowledging nursing input more frequently and treating staff with greater respect, though the change seemed motivated more by professional necessity than genuine personal growth. More importantly, the incident had sparked broader conversations about workplace culture throughout St. Margaret's. The hospital implemented new training programs on collaborative care and professional communication, emphasizing that excellent patient outcomes required respect and cooperation among all team members. Keisha began her graduate studies the following fall, attending classes in the evenings while continuing to work at St. Margaret's. Her experience had reinforced her belief that nursing was not just about clinical skills, but about advocating for patients and modeling professional excellence even in challenging circumstances. Dr. Chen remained an active board member and continued to make unannounced visits to various hospital units, though he never again posed as a regular patient. His experience in room 314 had reinforced his belief that the true measure of a hospital's quality was found not in its technology or reputation, but in how it treated both patients and staff in moments when no one important was supposed to be watching. The Patient Advocacy Excellence Award became an annual tradition at St. Margaret's, with recipients chosen based on their demonstration of clinical excellence, patient advocacy, and professional collaboration. Each year, Dr. Chen personally presented the award, sharing the story of how the first recipient had shown him what truly exceptional nursing looked like. For Keisha Williams, the experience had been transformative in ways she was still discovering. The scholarship opportunity and recognition had certainly advanced her career, but more importantly, the experience had validated her belief that standing up for professional standards and patient care was always the right choice, even when it seemed risky or uncomfortable. Years later, as nurse practitioner Keisha Williams treated her own patients in St. Margaret's new community clinic, she often thought about that snowy February morning when an elderly patient had changed her life. She made sure to tell her story to nursing students and new graduates, emphasizing that every patient deserved their best care, regardless of who they appeared to be. The lesson was simple, but profound. In healthcare, as in life, you never know who's watching. And more importantly, it shouldn't matter. Professional excellence, compassion, and integrity should be constant, not dependent on circumstances or audience. Dr. Chen continued his work in healthcare philanthropy, but he never forgot the nurse who had taught him that the true heart of medicine wasn't found in boardrooms or administrative offices, but at the bedside, where dedicated professionals like Keisha Williams quietly made miracles happen every single day. The red sled that had started it all remained in the evidence room, a reminder that some stories end not with answers, but with the recognition that some mysteries are more important for the questions they raise than for the solutions they provide. And sometimes the most important truths are found not in what we discover, but in how we choose to respond when faced with uncertainty, injustice, or the simple opportunity to do what's right.